Hi, this is Lydia Quella, and this is my key assessment presentation. My research question is, in adults with high blood pressure, does consumption of high flavanol dark chocolate over 24 weeks maintain a reduced systolic blood pressure? The null hypothesis is adults with high blood pressure who consume high flavanol dark chocolate for 24 weeks will not maintain a reduced systolic blood pressure. High blood pressure is an important risk factor for cardiovascular disease. It contributes to about 50% of cardiovascular events worldwide, and the number of people with high blood pressure is expected to rise due to unhealthy lifestyles. Specific lifestyle factors such as diet, smoking, sedentary behavior, and alcohol intake has been identified as most associated. Every 20 mmHg decrease in systolic blood pressure reduces the relative risk of heart disease by 50%. Many studies have examined the effects of dark chocolate on blood pressure. Reported beneficial effects of dark chocolate at 2 to 12 weeks, looking at dark chocolate and blood pressure with different variables. For instance, dark chocolate versus white chocolate outcome illustrated that dark chocolate results in a significant decrease in blood pressure compared to white chocolate. Looking at high flavanol versus low flavanol dark chocolate, results presented high flavanol cocoa and dark chocolate treatment associate with a enhanced vasodilation by significant reductions, as well as a study looking at acute and habitual intake of flavanol enriched cocoa and or dark chocolate have reported to increase flow-mediated vasodilator response, thereby effectively lowering blood pressure. But the thing to note is that all studies have really been completed in a short length. Systolic blood pressure is more important than diastolic. Systolic blood pressure has the greatest sense of risk for having a stroke or heart attack. The Kuna Indians inhabit the San Blas Islands of Panama. These evidences have first been established by studies conducted in this population. Their blood pressure does not rise with age as would be expected, and there's no genetic protection noted from high blood pressure for this population. Therefore, it has been determined that an environmental factor has prevented cardiovascular disease. Exclusive to this population is cocoa intake, mostly through unprocessed cocoa beverages. The Kuna Indians drink approximately 4 8-ounce cups per day, which is 10 times more cocoa than the Panama mainland counterparts. And they have an 80% less chance of cardiovascular disease. Flavonoids are a subgroup of polyphenols found in many fruits and vegetables, and regular intake of polyphenols may have favorable effects on health and risk of chronic diseases. Chocolate has a higher flavanol content than most flavanol-containing foods and beverages. The main variables is how the product is manufactured, how it's produced, and the soil it's produced in, the crop itself, as well as the harvest and climate. A 2014 study by Carlson and Associates found isometric resistance training lasting 4 or more weeks in healthy adults has the potential to produce significant and clinically meaningful blood pressure reduction. However, it can be determined habitual exercises must continue to maintain positive effects on blood pressure. Medication management is also very common and popular, and a majority of people can achieve a blood pressure less than 140/90 with antihypertensive medications. However, medications to control blood pressure only works if continual routine is maintained. So now that long-term high blood pressure management has been proved in other treatments, that benefits will not be sustained if treatment is not sustained, the same can be assumed of dark chocolate and the effects on blood pressure. So additional research is really necessary to further investigate the influence of high flavanol dark chocolate for an extended period of time. The objectives are to further explore management of high blood pressure with continued use of flavanols, to determine if extended length of time confirms results that have already been established as significant, and we want to add new evidence to the current scholarship by studying adults with high blood pressure consuming high flavanol dark chocolate over 24 weeks. It is a quantitative experimental design focused on adults 35 to 70 years old. Recruiting volunteers from Baylor Medical Center Dallas will take place using their electronic medical record for recently diagnosed high blood pressure adults with a systolic blood pressure greater than or equal to 140 and a diastolic blood pressure greater than or equal to 90. Potential participants will be screened in order to be excluded for special diets, lactation, pregnancies, congestive heart failure, diabetes, malignancies, chronic kidney disease, severe cardiac arrhythmias or inflammation, and they will need to be non-smokers for at least 5 years or their life. Chronic medications must also be maintained for at least 2 months. And as far as the intervention, the chocolates are to be delivered monthly and compliance assessed by asking how many of the chocolate bars have been used. Individual adherence after 6-month intervention is to be determined by the total number of chocolate consumes. So if the individual has consumed less than 80% of the chocolate, they are to be excluded. Subjects are to be advised not to consume any other chocolate during the period of the study, as well as to not make any further changes to their diet, lifestyle, and physical activity. The subjects are going to be given the chocolate bars provided by Farmland Co. Participants will not receive information regarding the contents of the chocolate, but it will be 83% cocoa solids, 25 grams of chocolate, and contain 450 milligrams of flavonoids, as well as provide 143 total kcals per day. Systolic and diastolic blood pressure will be properly measured in the right or left arm supported at heart level in a seated position after 10 minutes of rest by a trained nurse using a mercury sphygmometer. Blood pressure will be taken prior and after for study results. An a priori analysis using G-Power and the mean difference between two dependent means of matched pairs was completed to confirm a total sample size of 27. But due to the length of the study, attrition should be counted for. So a minimum of 35 participants are to be needed to account for 30% attrition. Anticipated findings regarding the reduction of systolic blood pressure over 6 months will help fill the gap in the literature and further research of the use of natural and homeopathic uses of chocolate for high blood pressure management. As far as ethical considerations, informed consent, the study will be thoroughly explained to the participants. Personal identifiers are always a concern. We want to make sure that we are seeking approval through the IRB due to the use of human participants. Limitations would be the sample size being small, may not be getting enough diversity, and the length of study is longer. Participants may not complete it. A lot can happen in 6 months. And here's my references. Thank you.